The Trust feels that prioritising employee health and wellbeing is critical to the success of our business. Prioritising our employee health and wellbeing means, from all the research that we have witnessed, that it provides better health and care outcomes for the patients and clients that we deliver services to.
I woke up with a severe headache. I couldn't see out of my right eye. I found myself falling over, unsure of every step that I took. The outcome really was that the damage that had been done to the eye was irreversible, and that I was blind in my right eye.
I have a condition called acromicrotic dysplasia. I was diagnosed as a child, and during my teenage years I had quite a few surgeries on my legs and arms, which was fine. I had my physio, I was treated, and I was able to work as normal. But a couple of years ago then, I had a flare-up of back pain, which was completely new to me. I'd never had any back pain or back problems before.
I first saw Amanda in July 2015. She was referred to me by her manager because she had been off sick from June 2015, and it's usual practice for managers to refer staff who are off sick to occupational health.
I just had no confidence whatsoever. I felt safe at home. And it got to the stage then where I didn't want to go out. I wanted to stay in the house. I was turning into someone that I wasn't.
My boss from the Trust referred me to Occupational Health, which all happened nice and quickly, and I had some focused treatment.
Over the past 2 years, John has had occasion on 2 separate events to access early intervention physiotherapy through Occupational Health. The first occasion was when he had a flare-up of back pain whilst he was still at work, and accessing the service allowed him to remain in work whilst having the physiotherapy that he needed to keep his pain under control and allow him to keep doing his job.
Whenever Amanda came to see me in July, she was able to tell me about what had happened to her. I also got her consent to speak to our occupational therapist, Mrs. Diane Keys, to get her input. Diane had talked about the possibility of Amanda being referred to the condition support programme.
A month after Amanda's diagnosis, she was referred through to occupational therapy within Occupational Health for attendance at the condition support programme. We in the Belfast Trust refer staff on to Blossoms, which is a horticultural therapy unit based in Larne. They're funded through the Public Health Agency, and they provide an 8-week course based around horticulture and getting back to nature.
I enjoyed my Tuesdays at Blossoms. It was all about plants and about seasons. I always felt that there was somebody there to support me.
Amanda had highlighted with Dr. Shields difficulty in relation to medication calculations. She was referred through to occupational therapy for cognitive assessment. The actual difficulty related to her emotional response, to her difficulty recalling information.
Amanda's memory was within normal limits, and the difficulty that she was experiencing was related to her anxiety. Diane and I agreed then the best way forward would be to organise some psychology sessions for Amanda. We arranged for her to see Lisa Coy. She was able to manage any situations where she felt anxious quite well with the coping strategies she developed from Lisa and breathing techniques. She'd been in contact with work herself and was very keen to resume.
Obviously, whenever I had the issues with my back, I was quite worried as to whether I would be able to continue doing what I wanted to do. I want to work in the cath lab where I've trained, where I've worked hard, because at the minute I'm still maybe not 100%. I'm able to come out of the cath lab for a day, go back downstairs to an outpatient environment where things are a little bit easier on me, which, you know, is helping in the long run to prevent any flare-ups.
Luckily, John responded very well due to the sort of hard work that he put in, and he was able to return to work, gradually reintroduce himself into the clinical part of his job.
I think Amanda's case demonstrates very well the importance of helping staff with their health and well-being, and supporting staff who are off work sick, and the positive outcomes that can be achieved with input from a multidisciplinary team.
Every problem that I presented to Occupational Health, there was a solution to my problem.
Whenever we evaluated her progress at the end of the 6 weeks, there was significant change.
Everything was still going well, so I advised at that stage that Amanda could return to work.
It's like I haven't been away.
You've not only got the stress and the anxiety about being off work, but then you're always worried about how it's going to be whenever you get back. My manager was absolutely fantastic. We kept in touch more or less on a daily basis, so she knew where I was at, and I felt more than comfortable to go to her with anything.
I want to prove to everyone that I'm still the same person. Nothing has changed in my life other than the fact that I appreciate life more and I want to enjoy it more.
Everybody knows that you're happier if you're doing a job that you enjoy, and it's going to make the experience much better for everybody.
In 2015, the Trust set out on a journey to brand its employee health and wellbeing approach and developed the Be Well initiative. And Be Well was really bringing together a number of various strands and programmes and initiatives under the banner of one simple message that staff could have affinity with and understand. That's what the Trust is relaying the communication on when it talks about employee health and wellbeing.
In such a large organisation, getting the key messages out there, such as how to manage chronic low back pain across such a large array of sites and across a 24/7 service is very challenging. So we knew we needed to do something a little bit more innovative, and understanding the way that people access information now has changed over the last 5 or 10 years. We decided that we needed to think such along the lines of an app or a website. In the app itself, there's 3 different sections. There are positive choices, which is a section that deals with lifestyle factors such as alcohol consumption. There's the physical health and wellbeing section, which is entitled Be Active, and there's the psychological and emotional wellbeing section, which is called Mind Your Mind. And my physiotherapy team and myself put together some exercises that allow individuals to go on and view how to maintain and improve the mobility, for example, of their lumbar spine. You can click on the videos that are embedded within the app on how to do that. It gives advice as well on the importance of sitting less at work and the growing evidence surrounding the toxicity or the harmful nature of sitting all day, and gives some key pieces of advice on that.
Health and wellbeing isn't only about times when they're sick, but it's actually about taking preventative action and trying to improve emotional health and wellbeing as much as anything. Well, the Belfast Trust is fully committed to the health and wellbeing of our employees. For us to be a high-performing organisation and to be a world leader in health and social care, we need a workforce that is healthy and motivated. And in that regard, we are fully committed to improving the health and wellbeing of our staff. But to do so, we want our staff to take responsibility to become health and wellbeing champions for themselves and for their families. Because the impact of that on wider society will fulfil one of the Chief Medical Officer's objectives of improving population health and wellbeing within Northern Ireland.